Most of us know how difficult it can be to live without health insurance. However, think about how hard it is for people who have been incarcerated for a length of time and have to start their lives over, finding a new job, housing, and who have to do it with no health insurance. Stay with us and learn more right here on this episode of The Issues. I'm Sarah Bernard, and thanks for staying with us. According to Missouri Appleseed, federal law generally prevents Medicaid from paying for health care when a person is in jail or in prison. However, Missouri Appleseed has helped to create a program of Medicaid for inmates in jail who are returning to society in order to help them start a better life and less of a chance to return to jail. Joining me today, I have someone from Missouri Appleseed and someone from the St. Louis County Department of Public Health. I'd like to welcome Mary Quant and Dr. Paula Oldig. Welcome, both of you. Mary Quant from Missouri Appleseed and Dr. Oldig from the St. Louis County Department of Health. Is that correct?
That's right.
That? Okay.
Thank you for having us.
Yes, I'm so glad you're both here. So something very interesting that we never really think about in everyday life is health insurance for people who are in prison and whether they're in prison or leaving prison, and how that gets handled. So let's start first with you, Mary, and let's talk about Missouri Appleseed, which is a program that's here in Missouri that you all do so much more than just insurance.
Yes.
So let's talk about that.
Yeah, well, so Missouri Appleseed, we're a small nonprofit. Like you said, we're here in St. Louis, but we do serve the rest of the state. So we'll travel around to counties. We spend a lot of time in Jefferson City. We do a lot of work at the intersection of public health, criminal justice, and child welfare. And a lot of that work is we will help educate legislators about legislation that's coming up that we think would benefit Missouri families. And then some of the work that we do is policy implementation. So once we've passed these great bills or come up with a great idea, how do we implement it and how do we make sure the most families can actually benefit from it?
So let's talk about some of the very specific things that Missouri Appleseed does. And we're going to get into the whole Medicaid insurance in a moment. So what are some of the other things that you all do?
One of the projects that we're extremely proud of is a few years ago, we were able to work with the legislature to pass funding in the state budget that allowed the women's prison in Vandalia to develop an entire wing devoted to moms and babies. So before that, if a woman gave birth in Department of Corrections custody, by law, necessarily they were separated at birth. So mom had 24 hours and then had to say goodbye. And so now moms and babies can stay together in that wing up to 18 months and then leave together at the end of mom's sentence, which just is an incredible improvement, and it allows moms to have better success at reentry, to maintain those family bonds, and long term, we just know that it has incredible outcomes. So that's one of our favorite. That's just that recently,
and it just makes sense.
Yes, and we're the only state in the nation that actually
I was going to ask you that.
Funds it publicly.
Okay.
So I think there are 10 prison nurseries now across the country, but we're the only one that actually has state funding for it, really showing that the legislature was truly invested financially and emotionally in making sure we had this option for moms and babies. And it opened in January, so we were really thrilled that it's finally
just opened just a few months ago.
Yeah.
I bet the moms are just thrilled.
Yeah, it's incredible.
How many births have there been since you implemented it?
I know there have been at least 3,
okay.
But they have capacity to hold up to 14 mom and baby pairs. And I think there's also a mom expecting twins, so it'll be busy very fast.
Oh, that's really wonderful. That's great. So what are some of the other things that you've done?
So legislation this year, we also were able to ban shackling, so handcuffs for pregnant women in their 3rd trimester who are being held in jails. And also guaranteeing nutrition supports for pregnant women in jail, so prenatal vitamins and extra calories if necessary. We helped to repeal the Missouri Reimbursement Act, which allowed the state to arbitrarily seize funds from people coming out of jail who've served their time to pay for their incarceration. And this was really unfair to our system of jurisprudence in this country, which says once the judge gives you a sentence, you pay your time, you get to go back to society. And so to take their nest eggs or any small amount of money saved before going back into society was a huge impediment to people being successful. So we're really thrilled that that one's been that has been repealed. And then, of course, we do a lot of the Medicaid work, working with access to public services for people trying to reenter successfully.
Yes, we're going to come back to that in just a moment. You've been with Missouri Appleseed for several years now.
Yes, about 3 years.
And how long has Missouri Appleseed been in existence, do you know?
Yes. So our executive director, Liza Weiss, started it in 2017. It was just her at first, and so we're really proud of the work that we've been able to accomplish.
So
since
not
then.
that long.
No, it's very young,
and
8 years.
You know, it's amazing to me that these things that seem so normal, like things that would come up in daily life in prisons, it takes somebody sometimes from the outside to come up with these ideas and help get them implemented. So kudos to all the people at your organization. It's amazing. Dr. Olda, let's talk a little bit about you. So you are at the St. Louis County Department of Public Health at the jail system in Clayton specifically.
Right. Yes.
So tell us a little bit about what you do there.
Sure. So I'm the medical director at the Buzz Westfall Justice Center, otherwise known as the St. Louis County Jail. It's right in the middle of downtown Clayton, and you wouldn't even know, but there's almost 1,300 people housed there right now. We also take care of the residents at the Juvenile Detention Center, which is across the street, and there are about 60 youth currently housed at the Juvenile Detention Center.
So you see firsthand the medical needs, and this is the jail system, which is different from the prison system. So talk a little bit about that.
Yeah. So a jail is where people are generally being held while they're waiting for their trial or waiting for their sentencing. Very often they're not convicted of anything. However, when someone is arrested and incarcerated, they immediately have their benefits suspended. In the past, but thanks to Missouri Appleseed, they used to be terminated, like completely cut off. Now they're suspended and put on pause.
So when they were cut off from having health insurance, they could never get it back. Is that correct?
They could, but the issue is once you're getting out of jail or prison, you have all these things like you mentioned, housing, job, family reunification, and very rarely when you're applying for public benefits are they instant. So
I see.
To take the time to apply, to handle this complicated paperwork, to wait for your cards to come back. That's the real issue, is just you have this huge gap when people are at their most vulnerable.
So people would get out of the prison system or the jail and then have to start over, and there was a long delay at times. So now being suspended, is it automatically reinstated then when they leave?
It's not. So when somebody is incarcerated in the facility that I'm the director, the bill is really footed by the taxpayers of St. Louis County because those benefits are on pause.
Okay.
In order to get them reinstated, they have to reapply for reinstatement. And so that's where Missouri Appleseed comes in, and it's been a wonderful partnership to help the residents of the jail prepare for reentry. So upon release, for their post-release life, they have health insurance waiting for them. So they can fill their medications, have some access to doctor's appointments and visits. Folks who are incarcerated have a much higher incidence of chronic medical conditions, particularly mental health diagnoses and substance use disorders. Maintaining a consistent medication schedule is super important to maintain health and maintain safety.
Right.
If you take your medication, your physical and mental state are such that you can get a job, you can get back to your family, get back to your life, and break the cycle of recidivism, illness.
So while they're in the jail or prison system, the costs of medical care are covered by taxpayers.
That's right.
Okay.
That's right. Yeah.
So let's go back to you, Mary.
Yeah.
So we have someone who's in the system, and they are going to be leaving in 2 months.
Yes.
At what point do they get involved with you? Because Missouri Appleseed now is helping them to get signed up, so when they leave, there's less of a delay, or is there any delay at all then?
So it depends, just simply because we have a large state with a lot of people who are trying to interact with the public benefit system. And so one of the ways that we approach this work is to work directly with county jails, jail administrators, medical staff, finding someone, going to these places, training them on Medicaid, because it's a wildly complicated topic, even for Medicaid lawyers. And so explaining them, helping them come up with the best system for it. So sometimes it's when they're first coming in, they'll screen people to see if they even have Medicaid. So there's a lot of Medicaid applications that are submitted because folks don't know that they have Medicaid, they have lost their coverage, because you have to renew it every year, and if you don't know that,
So some people are coming in without any insurance at
Yes.
all.
Right.
What about, and I know Missouri Appleseed is specifically working with the Medicaid system,
Yes.
but someone who comes in with regular health insurance,
Yeah.
is there a pause to that as well then, or is that maintained?
Sometimes.
Okay.
Yeah.
And it all depends. There's a huge variance, policy to
Yes.
policy,
Okay.
company to
So it just
company, so
depends.
all
Yeah.
bets are off. The majority of residents of the county jail do qualify for some type of public aid.
Okay.
Yeah.
Okay, so this Medicaid discussion is really, really important.
Yes.
Yes.
And Missouri Appleseed, in addition to obviously St. Louis County Jail and the systems here in St. Louis City too, you are across the state in
Yes.
how many jail systems?
We've currently worked with and trained over 20 jails. Some are really small, they hold maybe 10 people a week. Some of them are quite large, like Dr. Oldig said, over 1,000. And so we try to really tailor the approach to see what works best for each jail, to make sure that it's easy for them to do it, they have the right tools, and then we stick around and stay in really close contact with all the jails that we work with to help troubleshoot issues. You know, I haven't heard back about a client, or they're having trouble turning it on, and so we liaise with the state. The department that we liaise with is the Family Support Division, to figure out what's happening, because things get caught up in the shuffle sometimes.
Right, so 20 systems across Missouri.
Yes.
And to put that in perspective, how many jails are there, jail systems?
There's a little over 90. So
Okay.
even though there's, I think, 114 counties in the state, some counties do share jail systems. So
Okay, so there's a lot, so is the goal to get all of them?
I would love to get
Yeah.
all of the jails. We're really lucky. We've had really great relationships with the jails that we've worked with, the sheriffs and administrators who've really spread the word about the work that we're doing. We've also been able to partner with the Missouri Sheriff's Association, who've been huge supporters of Medicaid access. They know it is a necessary tool to help the people in the jails that their sheriffs oversee. Because a lot of these counties, you know, St. Louis County is pretty well funded. And a lot of these other counties are really struggling with the budget that they have to provide the level of acute care that's needed.
So it's a matter of getting into these jails and training
Yes.
people and,
Yes.
and explaining why this is important. But it
Yes.
sounds like they're very receptive, but I'm sure
Yeah.
the number of people you have to go and do this
Yeah.
is somewhat limited as well. Yeah, well, we're gonna take a break in just a minute, and we're gonna actually hear from some inmates that you've helped, which is great, and see what they have to say, and then we're gonna come back and talk more about how our viewers might benefit from this and how they can help others as well. So thank you for joining us. We'll be back after this break. We'll be listening to some inmates who have benefited.
My name is Patty Berger. I'm a formerly incarcerated woman. I've been out of the Department of Corrections for about 23 years. One of the biggest obstacles for most people is getting out and not having anything in place, such as health insurance. When I was going in and out, one of the problems was that I never received treatment for an addiction. Every time I got out, I end up going back because I didn't have anything in place. And people do need to see doctors or a treatment program to get into when they're released. Medicaid helps with that.
Cynthia Talbert, I got out of jail July 14th, 2023. I would say this service here, Medicaid, would be the best thing they would ever do in their life, and they will help you with most of your benefits that you'll ever need.
Anything you need for your health, Medicaid can help you get it. It will help you on the outside for as, you know, your insurance of going to the hospital, getting checkup, dental, eyeglasses.
If I didn't have Medicaid, I wouldn't be able to get these beautiful dentures I have in my mouth.
Welcome back. In case you're just joining us, today's topic is Medicaid in jails. Let's continue our discussion with Mary Quant and Dr. Paula Oldig. Welcome back, Dr. Oldig and Mary. So we've been talking about how important it is for everyone to have health insurance, of course, but certainly our inmates, as they're getting released and going back into society, how important it is for the success of their lives to have access to good medical care. Before we go back into some of the details of that, Dr. Oldeg, let's talk about medical care in our prison and jail system. So you're right there, you're medical director at our St. Louis County Jail in Clayton. What's your life like? What are the kinds of things that you're doing to help the inmates?
Sure. So the medical care in the jail is really, in a lot of ways, not that much different than the medical care in the community. We have a clinic and we do primary care visits for chronic conditions, asthma, high blood pressure, diabetes, conditions that are treated every day in the community at a primary care office. We also treat a large number of folks who suffer from mental illness. So we have a psychiatry team we work with to help folks with depression, anxiety, a lot of post-traumatic stress disorder, and even some more serious mental illnesses. Another big area that we focus on is folks with substance use disorder. Almost 40% of the people who are currently incarcerated carry a diagnosis of substance use disorder of one form or another, and that number might even be higher than what people are admitting to.
And so in addition to primary care medicine and the mental health that you're talking about, mental health care, they also have access to dental care.
That's right. We have a dentist who comes on site, and for many of these patients, this is the first time they'd seen a dentist in years. And really that goes for almost all of the medical care. There are a lot of patients who have not seen a doctor in many years. So this is their first opportunity to have some of these chronic issues addressed.
Is it required when they come in as an inmate? Are they required to get medical care?
They are, yeah. So through the Constitution, through the 8th Amendment and 14th Amendment for prison and jails, you can correct me if I got flip-flopped, it is our duty to provide medical care, because not to do so would be cruel and unusual punishment. So upon entry to the jail, all inmates or residents undergo a intake screening. So it's a full checklist of current medical conditions, allergies, what medications are you on, really just like when you go to a primary care office.
Right.
You know, that clipboard they hand you with a list of conditions.
Right.
We do that on the way in
to
make sure that patients are cared for, to make sure that they're not going to suffer from not having necessary medication, and that they're not going to suffer from withdrawal symptoms or symptoms of any substance use that's ongoing.
And are they put on a regular schedule of visits with you and your team? Okay, so they're going to see you more than once.
Yeah, often they do.
Okay, very good. And would you say it's similar at the prison level as well?
At the prison level, yes. So the prison is different, and in some ways it's easier because the people are there for a more defined period of time. People in prison are convicted and going to be serving a defined sentence, whereas in jail, they're being held. So people are coming and going literally at all hours of day and night. So it's a lot more moving targets, but we really take pride in making sure our patients get the care they need.
So they've come into the jail or prison system, maybe receiving medical care, regular medical care for the first time in a long time. And so all the more reason then, Mary, for them, for us to encourage that same level of care when they leave, to continue the success that they've built in terms of taking care of themselves.
Yes, and I do want to point out, St. Louis County is a wealthier county. So many jails across the state don't have the same resources. So in the county, really a great but unique relationship is that the County Department of Public Health helps implement some of the health care at the jail. And a lot of our smaller counties with much lower tax revenue, sheriffs and jail administrators are trying to provide the constitutionally required health care with very small budgets. And so stabilizing people might be the best that they can do, or getting them some health care through the local hospital or just the CNA that they have on staff. So it's even more critical for a lot of these rural places, people intersecting, and perhaps they're able to get sober, perhaps they're able to get on some medication, but this is the intercept point that they can then get the Medicaid, so when they get back to their community, they may actually have a chance to stay healthy and get their teeth fixed or get the glasses that they need to see. and actually get a job.
Right. So going back to the Medicaid
Yes.
option, so when you, how does it work if someone's an inmate?
Yep.
And then is there a point at which that you're in contact with them to start the process of enrolling?
So we work directly with the jails generally, and we also do a lot of focus groups and work with affected community members who are returning to the community. But a lot of the policy implementation is with the jails. So we train the staff and let them decide what the right point is for intervention. And then they'll submit the applications. They send me numbers to know how many people they've worked with. And again, because some of these jails are just so small, the staffing isn't consistent. We try to find a solution for them. We give them a tablet. We ongoing technical assistance. How can we help you do the right thing, which is what they want to do?
So Missouri Appleseed's role is to help the staff,
Yes.
who then helps the inmates.
Yes.
So at the inmate level, is anyone ever denied Medicaid when they're
Yes.
leaving?
Yes, a lot of them are procedural denials, which does mean that it's an error with the application or the system. There's a much lower number of people who are actually assessed as ineligible for whatever reason. And so we work closely with jails to try to make sure that someone on the other end is flagging the ones that come back saying, oh, we were denied, oh, we were declined, to make sure that we can fix the procedural problem. Like I said, we work with the Family Support Division that handle the applications, and we have some great contacts there who've been really passionate about figuring out why it's not working.
So it's usually procedural. It's usually a
Yes.
system error or something
and
like that.
that holds for Medicaid in general. Any sort of benefit program across the state, most denials are procedural and not reassessments.
Got it, got it. So do you have a sense of how many former inmates have been helped through this program?
Well over 2,000. We've kind of lost track of the exact number, especially because as people leave, it's harder to count the people who maintained coverage, but easily thousands of people have been able to leave jail with health insurance. And not just health insurance, but the education and the understanding of what it means. How do you use it? How do you access it? How much will it or will it not cost? So, because a lot of those issues are also really important too. You can sign someone up for Medicaid and never tell them. That doesn't help them actually access the things that they need.
So do either of you have a sense, we're talking about Missouri and things that are happening right here in our St. Louis area. Across the country, is this something that is rolling out to jail systems and prisons across the country, or did it start here?
So our process is quite unique, mostly because it's so recent. So Medicaid expanded in 2022 is when it went into effect. So it's really been only since then that enough people have been eligible for us to run a program like this and try to create this system. Lots of other states have different programs, though, especially because Medicaid is implemented differently in every state. The eligibility requirements are different. The application process is different. So we have looked at other states to see what works really well and what we could try to implement here. And then of course we're always paying attention to federal Medicaid policy, because Medicaid is a national state partnership where it's administered at the state level, but a lot of the money comes from the top. And so we have to make sure we're paying attention to what's going on there.
So does every jail system in our metro area have this program, or are you still working to?
We're still working.
Okay.
So we're St. Louis County, obviously, is our bedrock, working with the city jail. And then there's some of the closer counties that we've worked with are Montgomery, Perry, St. Genevieve, Cape Girardeau, Washington, some of the surrounding areas. And we've spoken with more jails too, who for whatever reason they have new staff that are coming on, or they're interested but not quite ready. Definitely have talked to everyone. I'd love to be in every jail.
Of course, that is the goal for sure. Dr. Oldig, do you get questions from your patients in the jail about insurance and what's going to happen when they leave?
Absolutely. So you bring that up as one of the bigger questions I get. So when I'm released, how am I going to get my medications? How can I maintain my recovery from substance use and get into a program? So having Medicaid is really a key to accessing your medications, because for folks who are going to recovery in the jail, oh my gosh, it really is just so rewarding, because folks come in the throes of withdrawal, really, really sick often, dizzy, feeling awful. We are able to start some medication, particularly for folks with opioid use disorder, and a month later, oh my gosh, brand new. They're like, wow, I want to be a mother to my 16-year-old. I'm going to get back and get a job. I have some ideas about what I want to do. How can I stay on this?
Yeah.
And so really having Medicaid allows the medications that we've initiated in the jail setting to be continued.
Yeah.
And that's what it's about, is that way they can be a parent, they can get a job.
Yeah, that's amazing. It's wonderful. So let's go back to Missouri Appleseed for just a moment, Mary. So all the different programs that you all, we talked about at the beginning of the show, that it's so much more than this, talking about the Medicaid enrollment, but this is very important. But how are you conducting interviews with inmates?
Yes.
Or while they're in the system and afterwards to learn what they need?
Absolutely. Everything that we have ever done has come from community partners and affected family members, formerly incarcerated folks. So we are really, really lucky to work closely with some incredible community organizations. So Keyway is one of them, and they help women coming back to, well, and men, but they help individuals returning to their community after being in prison with housing, job, any sort of social services that they need. And so we've worked closely with them to know what their clients need, and we've done focus groups and interviews, and we're really intentional about building that into any grant that we write or any plan that we have for a project. Is we need to make sure that we're not only spending time gathering that information, but really paying them for their expertise, because we're going to use that to build programs that help others.
Right, absolutely. Well, that's really wonderful. You all have been wonderful guests. I want to thank you both for being here. Dr. Oldeg and Mary Kwan, thank you so much for your time and your just knowledge and things that you've taught our viewers. So I hope today's topic has helped our family members to know how to help a loved one who is returning to society. And remember that you too can join the discussion. Log on to Facebook, YouTube, Twitter, Instagram, and stltv.net. And don't forget to download the free STL TV app. Be sure to tune into our next edition of The Issues, where we'll have another informative topic that you can learn more about. Thanks for joining us.